Today's cardinal lesson is going to teach you how to possibly save some money on your Medicare supplement insurance. And that will be through the High-Deductible Plan G Medicare supplement policy. So to put things in context, we're not talking about Medicare Advantage. So if you're on one of these plans like Humana or United Healthcare, WellCare, Aetna, where you have to go to a network of doctors and that sort of thing, and you have a zero premium, that doesn't have anything to do with today's lesson. Today's lesson is for people that are on original Medicare, Parts A and Part B, and if you didn't have a Medicare supplement, you would have co-payments every time you go to the doctor and deductibles. But most people that are on original Medicare also carry privately an individual Medicare supplement policy. And that's an area that I specialize in, that I've worked in for many years. So what we're going to talk about today is the High-Deductible Plan G. And many of you have asked for this in your comments where I've done other shows on Medicare. And so if we're going to talk about the High-Deductible Plan G, we're going to dig down and explain the Plan G itself first, because it's necessary to understand that before you start looking at the high deductible. So with the Plan G, what it does is it fits just like a glove with Medicare and the Medicare supplement Plan G. The two of them just go together and do a wonderful job of taking care of your hospital bills, medical bills, that sort of thing. In fact, the G plan is so good that on your normal hospital stay, still can be something very serious. You know, you could have bills of $100,000, $200,000, $50,000. The Plan G is going to leave you with an out-of-pocket, if you have a Plan G in Medicare, of $233. That's it. I mean, literally, it's that good. And that's why it's so popular, and that's why so many people get on it. I mean, it's going to cover your basic hospital deductible, which is $1,556 each time you enter the hospital. Plan G pays that in full, and that covers you for 60 days, which is a long stay in the hospital in today's terms. And then under Part B, in your medical expenses or all your other bills besides the hospital bill, you've got a $233 annual deductible for Part B, and the Plan G doesn't pay that. It can't pay that by law now. And then as soon as you reach that amount, $233, the Medicare itself pays 80% of your approved expenses, and then the Plan G is going to pay that 20%. And there's no cap on the 20%. So that's why it's necessary to have Medicare supplement coverage. You know, if you had $100,000 in Part B expenses, you would owe $20,000 of that if you didn't have a Medicare supplement. The Plan G is going to pay the full amount of that. And if you do go to a doctor who doesn't take Medicare assignment and they did this excess billing, Medicare pays nothing for excess billing, and the Plan G is going to cover 100% of that as well. So the Plan G is really the best Medicare supplement policy in terms of benefits available to people who started Medicare 2020 and after. Now, there was the Plan F before that, which was actually just slightly better than the Plan G, but that's not available to the new applicants anymore. Now, so what we're talking about today is we're comparing the Plan G by itself, which is the best plan, and then we're looking at the High-Deductible Plan G, and we're going to look at some prices in different parts of the country. Okay, so in other words, why would I want one of these High-Deductible Plan Gs? And the reason is to save money on your premiums. Okay, and so when we're talking High-Deductible Plan G, how much deductible are we talking about? Well, this year, and it's always these weird numbers because it's adjusted for inflation each year, the High-Deductible Plan G has a deductible of $2,490 before it's going to pay anything. So In other words, it's just like having Medicare all by itself, no supplement, until you get to the point where the supplement would have paid $2,490. As soon as you get $1 over that, the high deductible Plan G is exactly the same as the Plan G itself. So that's the kind of deductible you're looking at, which is very scary. I mean, if this kind of number is scary to you, you probably ought to just move on to another video, okay? But what I'm going to tell you is people that are on Medicare Advantage plans, if you go into the hospital and you come out, or you have some outpatient surgery and some treatment afterward, you may be paying zero premium for your Medicare Advantage plan, but this number is not too far out of the equation for your out-of-pocket on your Medicare Advantage plan. So people that are on those plans, they've got some exposure, and they got actually exposure on a year-by-year basis of more than this. But I'm really directing this video at people who can look at this cost, you know, over 5 or 10 years and start saying, I'm going to pay substantially less for a Medicare supplement policy that has a high deductible on it, but over a period of 5 or 10 years, I'm going to save so much in premiums that I'm going to be able to pay those expenses out of my pocket and come out ahead, okay? And that won't be true for everyone, but that's the context that I'm going over this. So let's look at some prices. So I've got 3 states represented here. North Carolina, which just happens to be where I'm standing right now. It's where I live and we run our business out of. I've got Florida, and these are the prices in South Florida and Miami, so they're the most expensive in Florida. And Florida is one of the most expensive states. And then I've got California. And California is on the high end of reasonable, or the high end of this, is their prices are not that much different than they are in Washington and perhaps Minnesota and Wisconsin, of the states that have high-ish prices, but yet they're not the highest department. Anyhow, so I've got those 3 states represented. And for most of you around the country, you can look at premiums that are pretty similar to North Carolina, okay? And the numbers that I have in green, I've run this across 4 companies, and the numbers that are actually, I'll start with the ones in red. The numbers in red are for the regular Plan G, just that good benefit plan that's going to leave you walking out of the hospital in a pretty serious illness with an out-of-pocket of $233. Best plan there is probably the one we sell the most of. Those are the numbers in red. And this, by the way, is for a 70-year-old man who's single, who doesn't qualify for any special rates or anything else, just had to pick something, and that's the age. So if you're younger than 70, it's going to be less. If you're more than 70, it's probably going to be a little bit more. If you are female, a good chance they're going to be a little bit less for you. But we're just using these as an average for comparison purposes. Now, you know, if I'm looking here in North Carolina and I'm here and I have a choice of, there's really about 40 companies you can pick that all sell the exact same Plan G. And I'm looking, you know, I'm certainly not going to buy that from United American for $32.76 when I can buy the exact same thing from Mutual of Omaha for $1,571. I mean, it's just hard. This is shocking for some people. They look at this and they say, how is there such a difference in rate when it's exactly the same thing? And that's too long of an answer for this video. The answer to that is just, you know, we're going to look at pricing and we're probably going to buy it from Aetna because they're $1,416. Now, if you want to look at the high deductible Plan G, which now is going to be the same, the number in green is going to be the same as red, but you're going to have an annual deductible of $2,490. You know, the best price on that is Mutual of Omaha. It's $519. It's about $1,000 less in savings. So if you got sick that year and spent a bunch of deductible, you're in the negative. In fact, over 2 years, if you got sick once and had a big bunch of deductibles, so it's going to, in a normal price state, you're really going to have to look at 5 or 10 years and have some good years in there to finish out money ahead. But when you move over to Florida and you start looking, I mean, if I'm buying a Plan G, yeah, and a lot of people in these states buy Medicare Advantage plans, so that's a way to make your premium zero. But if you really want to be able to choose your own doctors, that's really important to you, and you're a Medicare supplement buyer, I mean, you look at this, the best deal going is $3,600 a year for the same Plan G that you can buy in North Carolina for $1,571, and it's going to leave you with benefits substantial. Now all of a sudden, when you compare that to buying a high deductible plan from United American for $1,080 a year, you're saving $2,600 just in the first year. That's just a little more in savings than the actual deductible. This is somewhat of a no-brainer for people that want to choose their own doctors that are in a very expensive state. And then I showed you California, kind of the same thing. You can look at the numbers. So this is just an either-or thing. And when if the price of your Medicare supplement has gotten high and you want to do something about it, and you're willing to accept some of the risk. Now, I will caution you, when you give me a call, if you're 70, 75, 80 years old and you've got some health conditions, you're going to have to go through underwriting even to buy one of these high deductible Plan Gs. And what I'll tip you off to is United American has really the easiest underwriting to accept people. I mean, I have lots of people that had an expensive Plan G that they've had with me for a number of years. They wanted to get that premium down. We couldn't get them with one of these other companies, but they were able to answer United American's questions. So we're neutral to the companies. We represent just about all of them. I'm Hans Scheil, and we're in all 50 states in the District of Columbia. I'll leave it up to you to get in touch with me, and I thank you very much for listening.